If you suffer from arthritis, you are certainly not alone. It is the most common cause of disability in America. Dr. Jeff Hodrick from the Southern Joint Replacement Institute is here to talk about the most common form of the condition, and that is knee arthritis. And doctor, first of all, thanks for joining us.
Sure.
What exactly is and what causes arthritis?
Yeah, sure, Vicki. Let's start by talking and looking at maybe what a normal knee looks like and what cartilage looks like inside the knee. So this is an example or a model of the knee. The thigh bone's up top, the shin bone's down below.
Okay.
In between is a joint, so that's where the movement would occur. The blue substance here is the cartilage, so you can see how it's nice and smooth.
Sure.
And that's what a normal knee looks like without arthritis. Now this is a second model that shows more of what arthritis is. So you can see this red portion, which is basically the gradual wearing away of cartilage, and that's what arthritis is. And then you get these other bumps along the bone that you can see, and those are bone spurs that the body creates to try to deal with the arthritis. So this is what a painful arthritic knee would look like.
Now, how do you know when you need to see the doctor?
Well, typically arthritis can present a lot of different ways. You know, you can feel just pain in your knee, you can feel swelling, you can feel stiffness. Sometimes it gets a lot worse the more active you are. Some people wake up in the morning and feel really stiff. I would say if it's bothering you just about every day, or it's keeping you from doing things that you enjoy doing, it's probably time to at least get an x-ray and see your orthopedic surgeon. Are
there other options than surgery?
Sure. There's a few things that we try all the time. So there's non-steroidal type drugs. Those are like over-the-counter, like ibuprofen, Aleve, those types of medicines. We also have prescription medicines like that. That helps take away the pain and inflammation. Unfortunately, there's nothing to cure arthritis or to build cartilage. The second thing that we try are usually injections. There's two types. We can try a corticosteroid, which is essentially putting an anti-inflammatory medicine right in the knee joint. And the other one is a visco supplement. It's a gel type injection. You usually do it in a series of about 3 injections, and it's thought to maybe fill in some of the cracks, provide a lubricant inside the joint, also an anti-inflammatory.
So contact your doctor if you're having any kind of trouble, and I guess together you can decide what kind of treatment you'll have.
Absolutely. I think that's the best first step, to at least get an evaluation, get some x-rays, and kind of have at least a consultation.
And if you have a knee replacement, which I understand you have a model here, how long does that last?
Well, there's really 2 types. You know, some folks, if you know that are bow-legged, sometimes only one side of your knee wears out, and there's an option called the partial knee replacement.
Okay.
So what we're doing, or what the design of a knee replacement is to replace that bad cartilage with metal and plastic. So you can see here that we take away the bad cartilage, replace that with metal, and then there's a plastic piece in between. This is an example of a partial knee replacement, and then the second one would be a complete knee replacement that you see here. So you can see how the metal covers the end of the bone, and then there's a piece of plastic in between. There's studies that have looked at knee replacement over the course of 15-20 years, and they can last that long.
All right, thank you so much, doctor. And you'll find the Southern Joint and Replacement Institute on Harding Road in Nashville. We'll put a link to their website on ours at newschannel5.com.
Also coming up, you can meet and talk to the experts from the Southern Joint Replacement Institute at a free joint pain seminar this Saturday from 9:30 to 11:30 at LP Field.
Information is going to be available on knee, hip, and shoulder pain. They do want you to make reservations. You can make them by calling 615-342-0038, or you can go to their website and register online at sjri.com.